This has been a semester-long course in about 3 hours. What we're going to do now is I'm going to ask some questions. I have taken questions that the audience has given us from the morning. I've grouped them, and some of them I'll read, and some of them I'll sort of summarize. Ask any of you to respond to them who wants to. And the first two questions have to do with a lot of the material that you've talked about and special categories, especially what you were just finished, Pat, talking about. Mentally ill women are incarcerated at a significantly higher rate than men. Why? And a related question is, there's this syndrome of abuse leading to incarceration, leading to substance abuse, all coming together, and these women being released from prison with high recidivism rates. So what does the literature tell us is causing this differential rate for people with mental illness diagnoses, for women with mental illness diagnoses, and this syndrome related to abuse? How does that relate to recidivism, and what can be done about that? It's a big, long question.
Am I on here? Okay, how's that? Okay. I want to go back to a study that Barbara referred to, and that's the ACE study. The ACE study is the Adverse Childhood Events Study. It enrolled over 70,000 individuals who were participants in a Kaiser Permanente healthcare plan, HMO. So these are normal American citizens. And the way the ACE study worked was it assessed all types of adverse childhood experiences, including abuse, but also exposure to natural disasters, losses like parental divorce, lots of different childhood events. One of the things that the ACE study researchers did was create what's called the ACE pyramid. And at the bottom of the pyramid is ACEs, the adverse childhood experiences, followed by disrupted neurodevelopment. So young children who experience negative childhood events tend to have direct impacts on their brain development, followed by interruptions in social, cognitive, and emotional development, followed by engagement, adoption of risky behaviors, early sexuality, smoking, alcohol and other drug use, followed by increase in infectious and chronic diseases, followed finally by early death. And one of the more important findings is that there's not a one-to-one relationship between each of these levels, but what they found is that the number of ACEs in a person's life increases the probability of serious health and behavioral health consequences geometrically. So if you have one, you're more likely to have some problems in adolescence and adulthood, but if you have 4 or more, the probability that you will have a serious mental illness, a serious addiction, and consequently serious health and health problems is dramatically increased. So the other thing that we find is that for women who come into contact with the criminal justice system, they tend to have many self-identified negative childhood events. And you can almost track their pathways through this pyramid as the same kind of pathway into the justice system. But remember, they're bringing with them these huge increased risks of mental health problems. But the way they're getting into trouble is earlier on with how they adapt their natural survival strategies to what has happened to them in early childhood, whether that is running away and that gets them in trouble with a juvenile justice setting, the early sexuality, the drug abuse to meet their relationship needs and reduce their pain. And those are the same kinds of things that are getting them into trouble and then hooking them into the system in the long run.
I'd also, just in terms of how did we get larger proportions of mentally ill women in the system, we also have to cite things like mandatory drug sentencing and reductions in Medicaid, community mental health, and so forth, that then results in a population coming into prisons, and prisons are not designed to deal with that population and tend to increase the likelihood of acting out behavior because the population is just not, the setting is just not acceptable for those kinds of difficulties.
And I'm not sure how I turn this on either.
You're on. I think you're on.
One of my students looked at the ADSEG population in one of our so-called maximum security prisons for men. And she had access to all of their records, their disciplinary records, whatever assessments were done. And she found out of the women who had ADSEG and SHU terms, everybody know what I'm talking about, the jail or the prison within the prison, particularly those who had the 1 year, the 5 year terms, 75% of them had mental health diagnoses inside the facility. And I think one of the simplest answers is, when you look at that closed world, is that our correctional staff aren't trained to deal with the mental health-based behaviors, and they put them in the, oh, they're aggressive, oh, they're hurting. The most common charge was assault of an officer. But when you looked at the report, and we analyzed them very carefully, most of the assaults, my personal favorite, was going to the sink and putting an unknown substance from the faucet into a cup and throwing it on the officer. And they charged her with, you know what gassing is? Throwing urine. Well, I don't know about your faucets, but urine doesn't come out of mine. And the correctional officers, to their credit, don't know where to put these behaviors. Another woman was in for a very long time because she pushed an officer because he wouldn't give her a blanket. She was cold. She wanted a blanket. We used the escalation model, analyzing this person said this person said that, and all of a sudden the SWAT team is there with 5 people handcuffing her, dragging her out, videotaping it because she wanted a blanket. So I think our officers, and I'm very partial to my correctional officers, that they're not trained to deal with this kind of behavior, and in a prison setting, any pushback is seen as, oh, we're going to get stabbed, we've got to cuff them, we've got to throw them down. But again, 75% of these women had mental health diagnoses. So not only the question is, should they be in prison, but the question, should they be in SEG? There was nowhere else to put them in the facility. So I think just like there's few places in the community to put women who act out on mental health issues, particularly that can look kind of violent, same thing with the SHU populations and women's facilities. I just have to say, in California, again, we're crazy. We are now diverting huge numbers of so-called low-level offenders to county jails, which is going to be a mess. But they're taking one of my 2 big women's prisons. There's 2 near my house, Valley State Prison for Women and California State, Central California Prison for Women, and they're going to convert Valley State, the maximum prison. But in this prison, they put 8 women in a room with a door. There's only 1 officer station in the middle, and there's 256 women in the units altogether. They can't put that many fellas in there, and it just makes us laugh. This prison where they expected women to live 8 in a room with no problems, they know that's not going to be true. They're going to take off the doors, they're going to put additional staff in there. That just shows when the men and women don't behave the same. And so now we have this architecture that just isn't going to work for the fellas, and we're just all kind of amused. You expected the women to live 8 to a room built for 4, but no way will they expect the men to live that way.
So I have a quick question that I think asks for a generalization. In general, is it the socioeconomic circumstances of women or their substance abuse and addiction problems that leads to failure?
It's cumulative. It's interactive.
That was simple. Yeah. I had a whole bunch of them here dealing with race. And essentially they're asking different ways of asking the interaction between race and gender for this population. I'd like to have comments about that.
I will say, and it's very specific to the issues I was covering in my talk, we have differentiated the risk factors according to race. So how did African American women respond to this tool versus white women? And we tended to find that for African American women, the gender responsive variables are even more potent and predictive than the gender neutral variables in comparison to whites. So I don't know if that you find that helpful or not.
I recently read a study from Public Health that talked about the weathering effect of race and gender in this society. And it was a fascinating notion how being poor, being a minority person, and being a woman, like Barbara Bloom's talked about with triple jeopardy, actually is more weathering over the course of your lifetime. Things are just harder for minority poor women in this society. And this notion of weathering explains a lot of these more adverse or negative outcomes, in my view, across the life course. Women are a minority in terms of power, in terms of education, in terms of income. But when you look at minority women, all those things are aggravated. All those things are exaggerated in so many ways. And I think it's very easy in a white-dominated society to criminalize what Beth Ritchie, what many other researchers have called survival behaviors of minority women, survival behaviors of girls, that it's just immediately seen as more aggressive or more damaging. With white girls, with white women, particularly if they're in a higher SES, they're seen as, more problems that need to be handled privately as problems that need to be handled in a public venue. So when we talk about system responding to women, I feel very strongly that the system responds to both men and women of color in different ways as well.
I'm going to ask, I can't really see everybody out there. I had a colleague who was intending to come today. Luis Rivera, are you here? Dang. So I'm going to tell you what he told me. Luis is assistant professor in the psychology department. He does experimental psychology, and he's interested in looking at the effects of group attributions on personal performance as well as self-attributions. And what he means by that is in this white-dominated society, there are messages given to minority group members, negative performance messages given to minority group members, such as blacks are more likely to commit crimes. Hispanics tend to not complete high school. These are social messages that are attributing certain characteristics to minority group members. His interest is in also the degree to which people take into themselves those messages. And so it was interesting what you said about it doesn't work for whites, but it's enhanced for African American women. His point is that white people are not really aware of being white, so they have no strong affiliation to being white. But people who belong to minority groups have a range of strength of affiliation to their group. So if they have low affiliation to, for example, being African American, negative messages don't make a difference. But if they have strong affiliation to their group membership, the effect of negative messages is profound. And particularly, it has a lot to do with obesity and other health issues, self-esteem. So in a lot of ways, I think we have a setup for women who have negative messages, bias, discrimination, stereotypes. These messages all women are exposed to. And then African American women, Latinas, and so forth, Native American women are, in addition to that, taking on these other negative messages. And again, these messages are not additive, they're multiplicative. So if you have two negative messages, that's much, much more damaging to someone than a single message. And so I think we know that those stressors increase health consequences as well as negative mental health consequences. So I think in some ways that's part of the intersection of race and gender, and how that intersects again with behavioral health status, mental health, as well as involvement in the justice system. And I would say the other thing is that we know that people in prison do not come from, they're not randomly selected from the U.S. population. We also know that there is a clear selection process. So a white girl and a black girl can present with the same constellation of issues. The white girl may be processed into a mental health treatment program, and the black girl into prison. So, I mean, that's the other aspect, is that there's a procedural difference as well.
So I know we're pressed for time. I have two more questions, and I want to see if I can get quick reactions to these, because one is sort of putting three together. So we learned yesterday that if you design a program, a correctional program under evidence-based principles, you can expect to reduce recidivism rates. We're learning today that evidence-based principles might be different for men than for women. Does it follow that if you design programs for women based on evidence-based principles for women, you would have the same kind of reduction, bigger reductions, or smaller reductions than for men? It's a PR question.
I don't know.
We hope so.
I don't know.
But you hope so.
I hope so. We know we have reductions, but we just don't have that meta-analysis, that large group of studies that we need to have to say that.
And I know it's lunchtime, our favorite time of any session, but I just want to urge not only the Evidence-Based Institute, but all of you in your own agencies, open the doors to the researchers, encourage the researchers. We're in the same state that the medical field was, the healthcare field for years. Heart attacks for men and women were the same. Lung cancer for women and men are the same. Breast cancer, it was the same. Not so much. We now know that there's very different, not only trajectories, but interventions, and the research has been done. And I think that is the next wave for us, for our students, for you, for this institute, to start collecting this data in a rigorous, outcome-oriented way, but at the same time to build the case. We feel very strongly that it's there, it just has to be made with evidence. And I think that's the charge here, is to start building this evidence so we can say these things with confidence.
That's a nice segue to the panel that we'll have after lunch. And I'm going to ask the question that will be a lead into that panel, but not for this group, but which is a question about advice for startups. Now, we're getting ready to start doing this work. What should we focus on first? What should we focus on second, and so on? After lunch, we have a panel of people who are doing work in this area, talking about the work they're doing and how they're trying to incorporate what we are learning about this material.